going to be talking to you about is a project that we've had funded through TAPS, reconnecting urban planning with health, and it's the Livability project. Before I start, I want to acknowledge all the sort of team players in the group. There's a number of chief investigators. What we tried to do is bring together people with planning, geography, health. So we've got social epidemiologists, we've got health people, but we've also got people outside the health sector. We've got an academic team, and a lot of the work that's been done has been led by these people in each of the states and states that we're working with. We've got a technical team because what we're developing is a GIS database, and so Susan Mavoa is leading that team, but we're also working with Vince Linehan at the University of Canberra. We've got a data broker, we call her the data hound. She's looking for data for us because one of the big issues that we're doing with developing livability indicators across Australia is to come up with the right sort of data. And then we've got our systems investigators who are in the health and non-health sector. So again, we've got James Collette from the Department of Infrastructure and Regional Development, John Miller from Hart, James Charlie, who's involved in TAPS, and then we've got our health collaborators across the different states and territories. We've got advisors, and we've got then national advisors, and these people from the national advisors form part of our work with our Centre for Excellence in Healthy Livable Communities, and it includes the Heart Foundation and the Planning Institute of Australia. So it's a pretty big team trying to nut this out. So just to give you a sense of how we're working, up the top we've got the TAPS advisory group, which includes all of our systems investigators. At the beginning of the project, we came together to sort of nut out what we were going to do and to get their input into the ideas that we had. We've got our chief investigators. I'm sort of project managing, but really the work has really been done by the academic team. So Hannah Badlin's leading the academic group. Susan Mavoa, as I mentioned, is leading the technical team, and then we've got our data brokerage. And so what we've done is, because we've tried to divide up the work because it's quite a big project, and so we've actually got state academic leads and state technical teams. So we've got a lot of the work being done not in Melbourne but actually across Victoria, New South Wales, sorry, that says Victoria, but it's Paula Hooper's in WA and in Queensland. So we're working across a number of different states. Okay, so just a background. The urban form, what we're looking at here is livability, and there's a lot of discussion going on about livability in planning. Melbourne, as you know, is the most livable city in the world. Now Canberra, we hear, has become, OECD has said that Canberra is the most livable city in the world. Melbourne is, by the Economic Intelligence Unit, is actually one of a livable city as well, and has been for 4 years. A lot of competition going in this state. We wanted to actually define what livability was from a health perspective, to use a health lens and to apply it in terms of the social determinants of health. And we'd started this work about 2 years ago now, working with the Department of Health Northwest region in Melbourne. And so we wanted to look at, well, can we come up with a definition of livability from a health perspective and look at the upstream determinants of health, trying to nail this so that we can apply it within the policy context. So we wanted to make sure that this was policy relevant. When we've come up with what is a livable community, there are definitions around, and the former Major Cities Unit had a definition, but we wanted to fine-tune it to really bring it into what it is from a health perspective. So we've said, well, from a health perspective, a livable community one is safe, socially cohesive and inclusive. It's environmentally sustainable. We did this work actually with a multidisciplinary group which included environmentalists. But we wanted to add in the other parts from a health perspective, other parts of the health perspective. So we put in affordable, diverse housing, linked to employment, education, public open space, local shops, health and community services, leisure and culture, and linked by public transport, walking and cycling. So we wanted to bring this all together, and in Victoria we're developing a livability index that covers all these different domains. So just down here we've got the policy areas. On the left there, policy areas, so we've said the inputs for a livable community would be related to crime and safety, housing, education, employment, health and services, transport, public open space, community development, entertainment and leisure, food and goods, other goods and the natural environment. We got this from actually reviewing the evidence about what a livable community is. We've published that work now. We've said that this is likely to affect intermediary outcomes which will have an ultimate impact on health and well-being, including chronic disease. Now, in terms of the research aims, so what we wanted to do for the TAPS project was to develop and validate national and state a set of spatially derived livability indicators of the built environment, and we wanted to choose the ones for TAPS that were related to chronic disease, risk factors and health outcomes. We wanted to create the state ones because we want to see if what we're finding is that we can get state data much more readily than national data. So our first step was going to be to create state, but ultimately to be able to compare across the country, we wanted to come up with national data, and that's proving to be quite challenging. It's a lot more work to create indicators that will all be state-based because of the idea that you've got to clean the data and prepare the data. So we wanted to come up with, so we will create state measures. We're going to relate those then to see can we replicate those with national data, and ultimately that would be the best outcome that we can come up with. We want to make sure that the livability indicators are aligned with urban planning policy discourse. We want to make sure that we use readily available spatial data. We want to have something that is standardised and consistent over time so we can actually monitor over time. We want something that's suitable for monitoring progress, and we want to look at spatial indicators that are related to chronic disease or health outcomes. So in terms of the domains, we're not using all the domains that where we've got our definition of livability. We're not using all of those. It'll be very difficult to do those all nationally at the moment. So we're starting off with 5 domains. We're looking at access to public open space, access to transport, the public transport system, but we'll also include walkability. We're looking at a national walkability index. We're looking at alcohol, access to alcohol outlets, and we're also looking at access to food outlets, both supermarkets and fast food. What's the task? Well, the first task is that we're reviewing the spatial related planning policies, and we've done that in the ACT, New South Wales, Queensland, WA and Victoria. We're going to test these policies, so we're going to create spatial indicators and we're going to test them to look at various health outcomes. We're going to look at, well, what's the optimum? Different states have got different policies and they may differentially impact on health and well-being. So what we want to do is actually see which of these is actually the better ones. If there's no appropriate urban policy that exists, we're going to look at the literature and see, well, what is the literature telling us? We're going to build the optimal urban planning policy indicators, and that's going to require GIS work. We're going to see if it's replicable. If it's not, we're going to go back and try again and see what we can produce. And then we're going to test our national urban planning policy measures with national health level health outcomes. So we're going to be looking at, do these indicators of urban policy have a relationship with health and wellbeing outcomes, and we'll be focusing on the chronic disease risk factors. We've had an advisory group input in choosing this process. We did have a consultation and we've got input from people, and then ultimately what we want to end up with is a national database of indicators. That's where we're going with all of this. I wanted to talk you through the process that we're going through. We've done this not so much related to TAPS, but we've done this for our work that we've been doing with in Victoria. So what we've done in the transport area, we've looked at, well, what are the sort of transportation planning policies that would be related to a built environment measure, which would be the upstream determinants of health. We've come up with, well, there's access to public transport and there's different ways of measuring that. There's access to cycling infrastructure and there's different ways of measuring that. And there's walkability. In terms of how that might relate to health and wellbeing down the track, we've looked at, well, access to public transport determines whether or not people use public transport. It affects how car reliant people are. It affects whether people cycle for transport and whether they walk for transport. In terms of intermediary outcomes, it affects our commute times, the vehicle miles travelled, traffic exposure, physical activity accumulation, and ultimately weight status, and then the long-term outcomes are social inequalities, mental health, chronic conditions. So this is the sort of thinking that we've gone through, and where we're going to be measuring is up on the left-hand side. We're going to be measuring access to public transport, access to cycling infrastructure and walkability, and testing it out with some of the probably the behaviours is probably as far as we'll go. Or we'll look at intermediate outcomes. We're looking at physical activity outcomes as well, walking and cycling. In terms of where we want to end up is that we want to end up with a group of, we want to have spatial maps of this. This is our walkability map that we've created. I know there's one in Sydney as well, but we want to create a national walkability map. We want to have national walkability, access to alcohol, access to food, and this is what we'll end up with. So we can, this is a map that we've produced for Victoria. We can use it for benchmarking policy and monitoring progress towards improving the walkability of cities. So we'll end up with a series of maps. In terms of our activities to date, I mentioned we've had our advisory. We have technical workshop, but we're actually having now monthly meetings of the technical advisory group who are working on the project, even though they haven't got any money yet. That's been one of the biggest challenge. We've identified and agreed on the scope. We've completed the review of the planning policies. We've commenced collecting all the spatial data, and we've developed a publication plan. So we're pretty much on the way to getting going, even though people haven't really got funding yet, but we're moving forward. We've got a newsletter that's gone out. It's on our website, but we've circulated that to everyone who was involved in the workshops. And we've also developed because we have a publication plan, what we want to do with all of our publications is give out user-friendly snapshots of what our papers are showing, and this is the template we're going to be using. So it's a simplified form of giving out information. What we did, what we found, so what, and that will be used to give to our policymakers and practitioners. We've actually got a lot of feedback on these because we've got quite a few advisory groups now for our Centre for Research Excellence in the different states, and they've all looked at this and they all like it. So that's what we're going to be using for giving out easy versions of what we're doing for our work. I want to thank Hannah Badlin, who's helped. She's leading this work, and I'm presenting her work here, so she's done a great job. So thank you.